Hi, I'm Emily with Blonde Hair Bar, located right here in the San Francisco Bay Area. Today we're going to talk about androgenic alopecia. This is a patient who has flown in from out of state to have us do her hair, and she has been struggling with hair loss since the age of 16. She's now 30 and ready to do something about it. Let's hear from her and what she's done and how our treatment plan worked. Hi, my name's Emily Wyatt, CEO of Blonde Hair Bar, right here in the San Francisco Bay Area, and we are here to talk about hair loss. And we have Rohini, who has flown in from Nevada to get help with her hair loss issues, and we're gonna hear from her story right now. Thank you so much for coming in today.
Thank you for having me. I'm glad to be here.
Awesome, we're happy to have you. So let's get started. When did you first start noticing hair loss?
Yeah, so I think I first noticed it about at the age of like 16, 17, right in my high school years. And it's kind of progressed since then. It was very minimal at that time. And just over the years, it's just gotten worse and worse.
Okay.
So,
how did you deal with that at 16 years old?
Yeah, 16, it's such a fragile age when you're that young, especially as a female, you're surrounded by like all kinds of media and stuff that show, that you can have all this great hair and whatnot, all these celebrities and things like that. So yeah, it was a bit rough when I was younger, but I didn't really do a whole lot to deal with it at the time because I was just kind of more focused on school and stuff like that. But yeah, like as I grew older and older, it started affecting me a little bit more and kind of stressing me out a little bit more, which sort of kind of became a vicious cycle in that stage where you stress about it more, and then more of your hair falls out, and it affects your hormones and things like that too.
Right. So what did your parents do to help you?
Yeah. So we're very deeply rooted in the Indian culture, and Indian hair is very well taken care of. It's like a traditionally well taken care of culture, I guess you could say. But yeah, my mom, I remember I would be sitting on the living room floor and she'd be on the couch, rubbing my scalp with coconut oil and stuff, just to kind of help stimulate the blood flow in the scalp. Yeah, she would help me with that. She always worried a little bit, about my hair loss and stuff, and tried within her, abilities to help me as well.
Right, that's good. Okay, so you didn't see any movement with new hair loss from the coconut oil then? No other real changes or anything like that. I think it didn't hurt to do it at the time, especially because I was still so young. We didn't want to really put me on any medications or any kind of severe treatments. So did you go to the doctors? And when did you go to the doctors?
Yeah, that's a good question. So I'm 31 now, and I all throughout my college and through my career, I never really dealt with it until this year. Oh. And so I finally decided, throughout the years, I've tried biotin, hair, skin, and nails, some vitamins and stuff, but nothing really helped, and I never really paid attention to it until this year. Okay. That's when I went to my first dermatologist in Reno, Nevada. And they tried a couple things. They started putting me on steroid shots and things like that for my scalp, which is a pretty harsh kind of thing to start with, a treatment to start with.
Did they know what was wrong with you?
They suspected that it was alopecia, some form of alopecia, but they weren't entirely sure what type of alopecia that it was. So they referred me to the UC Davis Health Center in Sacramento, which they're very well known with and very well they a lot of expertise and experts in that field of dermatology and hair loss and hair thinning. And so I was referred over there to their clinic, and they did a punch biopsy on my scalp, in which they take a small tool and literally take a section out of your scalp. Wow. And then they send those off to the lab to be tested, and they test the cells at a certain level.
Did it hurt?
They numb it first, yeah. So it's just a little pinch, probably that big, less than a dime. Yeah, sort of. And so they did that, and they sent that off to the lab, and of course the results came back. And that was maybe June or May of this year that they diagnosed me with androgenic alopecia with lichen planopilaris, LPP for short.
What's that mean?
So androgenic alopecia You can kind of see the word or hear the word androgens in it. Typically, it's male pattern baldness, but it happens for females as well. Okay. So male pattern baldness, like it's more commonly heard of, you know. So they've started noticing once, like females can have it too, and it could be for a variety of reasons: your diet, your hormones, just the pH balance in your body. The particular type of androgenic alopecia that I have is, it could be caused by anything, but there is also the LPP, which I had mentioned prior to that. The lichen planopilaris is actually an inflammatory component at the cellular level of the follicle, which is what my doctor had told me. And so we started on some various treatments for my hair, a topical solution that I was put on, an anti-inflammatory, which was like an antibiotic, which actually helped with addressing the inflammatory component of internally. Okay.
What was the topical?
The topical solution was clobetasol. It was I think it was also to help with the inflammatory component of that as well. I don't know exactly like all the chemistry and the medicinal terms, but yeah, so I had started on that, and they also put me on men's Rogaine, because men's Rogaine is also very very strong. It's a little bit stronger than women's Rogaine, and it's safe enough to use for women. At least that's what I was told, you know. And I used that, and you know, they prefaced all of this stuff with you know, they made it known that not every treatment is going to work the same for everybody. Right. So she told me, like, we may have to try something different if this doesn't work, you know. And so I was trying it, and I was also in touch with someone to help me do like the red light therapy. So I had ordered the iRestore laser light therapy helmet. So I've been using that as well. And I've been doing this for a few months now, and you know, I wasn't seeing any results just yet.
So you're doing 3 things: a topical, a light, an internal, 2 topicals.
2 topicals, a pill, and the laser light therapy I was doing at once. You know, and sometimes like different combinations and cocktails of medicines and solutions and stuff will help different types of people, or sometimes your body just won't respond to it, you know. And with androgenic alopecia, there's no real, like, the truth about it is that it won't get better. You can only prevent it and slow the progress of it getting worse.
Okay, so androgen, is that a hormone? Is that too much of something, or?
It can be too much of a certain type of hormone or something like that. I did get blood tested as well. They checked like my vitamin D levels and stuff. That was all normal too, which that kind of stumped them also as to like what we could do. So that was kind of the approach for the very beginning, you know, and I had stuck with that for a little bit.
Okay, so how long were you taking all of these medications? And this started at the beginning of the year?
Kind of at the beginning of the year.
This year?
Yeah, this year, 2020, yeah. And I had been taking them for about, I'd say, a good 6 to 7 months. And she said around that time is when you would start seeing results, if you would start seeing results. So I had a follow-up with her, with my doctor, and unfortunately, you know, she didn't really notice very much results showing up. No, it was the hair loss was a little bit more like progressed, you know, since then, because they had taken pictures during the first appointment.
So is your hair scarring after it falls out?
So yes, exactly. So the scarring that's happened, I guess, already apparently, due to whatever that may be, and I asked the doctor, you know, if it has to do with any harsh chemicals that I'm putting in my hair, the fact that I'm coloring my hair or doing all these dyes and whatever, and she said that there's really no reason for that to be affecting the scarring or creating or being a cause of the scarring. It's sometimes the body chemistry, you know, it's not necessarily what you're doing to your hair or your scalp. But yeah, so the scarring was basically I guess like the root cause of like the follicle not growing back and repeating that hair growth cycle.